It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. How to know when it's time to euthanize your dog. There's rarely a definitive answer about when the right time is to euthanize your beloved dog. Rather, it's a combination of factors. While no one can make this difficult decision for you, there are some things that can help. Talk to your veterinarian. One of the most common questions veterinarians receive is, when should I euthanize my pet? By asking your veterinarian for advice, they can guide you through this difficult task and help you make a decision. Your veterinarian will inform you about your dog's medical conditions, as well as the prognosis and progression of the disease. For example, your miniature Schnauzer might have been struggling with diabetes and glucose regulation for the past 2 years. Over time, he developed cataracts, leaving him blind, and was recently diagnosed with Cushing's disease, making his diabetes even more difficult to manage. Unable to fully adjust to blindness, your dog struggles through life, unable to enjoy his favorite activities. Now, faced with a diagnosis of Cushing's, accompanied by extensive treatment and monitoring, he may have reached his limit. Your veterinarian can explain the indicators of your dog's distress that you might not be aware of. He or she will also explain the euthanasia process to relieve your stress and anxiety. Monitor your pet's quality of life. For younger dogs who have suffered catastrophic trauma or illness without cure, such as a devastating car accident, toxicity that irreparably damages organ function, or a congenital defect that cannot be surgically corrected, deciding when to euthanize your beloved dog is easier. However, when dealing with an older dog who is slowly deteriorating, knowing the exact time to end his suffering is much more difficult. Use a quality of life scale to determine how comfortable and happy your pet feels on a daily basis. Evaluate 7 categories of happiness and comfort to determine your pet's quality of life. Pain. Is your dog uncomfortable and showing signs of pain, even with pain relievers, alternative therapies, and home modifications? Signs of pain include panting, licking the affected area, whining, reluctance to move, decreased appetite, difficulty getting comfortable, and decreased activity. Hunger. If your dog refuses to eat or experiences nausea, vomiting, or diarrhea, you may need to hand feed or use a feeding tube to ensure adequate nutrition. Hydration. If your dog is drinking more or less than normal, abnormal fluid consumption may be a sign of an uncontrolled illness. If you cannot get your dog to drink enough to maintain adequate hydration, your veterinarian may consider intravenous catheterization with fluid therapy or subcutaneous fluid administration. Hygiene. If your dog has developed urinary or fecal incontinence. The development of urinary or fecal incontinence is a deal breaker for many pet owners, especially when combined with immobility. A large dog can hardly remove its own urine and feces day after day, and it often damages the bond between owner and dog. Happiness. Is your dog happy? Does it still enjoy and perform its favorite activities? Does it greet you enthusiastically when you come home? Has it shown signs of anxiety and depression, withdrawing from the family? If your dog no longer enjoys its usual activities, consider whether you are prolonging its life for its own sake, rather than letting it go. Mobility. Can your dog move comfortably? Has it developed severe osteoarthritis or another disabling muscular or skeletal disorder? If your dog cannot walk or stand unassisted, consider the impact immobility can have on its mental health, well-being, and hygiene. More good days than bad. Does your dog have more good days than bad? Or have the bad days begun to outnumber the good ones? Eventually, you may find yourself looking for moments during the bad days that remind you of the good ones. A tail wag to get a favorite treat, a brief game of gentle fetch, or the devotion of following you from room to room throughout the house. If your canine companion has more bad days than good, consider letting them go peacefully with the help of your veterinarian. After their loss, turn to helpful resources and lean on family and friends to help you cope with your grief. Although you would probably prefer your dog to fall asleep and pass away naturally, a natural death can be a long, painful, and distressing process for a dog. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.